Pain, that medically elusive evil. What about changing the focus from controlling pain to understanding pain as more than a symptom? Can pain be cheated? My name is Dr. Dean, chiropractor and physiotherapist. My goal is to reframe how medicine understands pain to improve care. This podcast series is dedicated to a same-day conservative treatment for low back pain. This podcast has a companion published article number 34. Welcome to the Pain is Not the Only Problem podcast. Article number 34. Pain is Not the Only Problem. Phases of Healing, Part 1. These articles intend to reevaluate the prevailing clinical practices thought to manage low back pain, submit and debate novel low back pain contributors and mechanisms, meet patient expectations and satisfaction and clinically meaningful results, recommend a conservative non-surgical course of care to override pain instantly, and restore ADLs and patient confidence on the first visit at low cost. Healing and a return to usual lifestyle, ADLs, activities of daily living, or athletics, RTP, return to play, is the end stage of low back pain case management. It is not typical for the athlete or patient to desire only pain reduction while still experiencing the inability to perform personal care, return to work, and earn usual wages, also known as RTW or return to work, or to continue with sports training or the emotionality that coincides with non-specific low back pain. It is important for the clinician to understand all of that patient-athlete values, expectations, and desires in order to coordinate the right kind of care. And this is true especially with athletes. Athletes want to get back in play as soon as possible. However, it is not common for the medically based clinician to manage the patient's care in this way. Therefore, patient expectations and athletes' expectations are not fully met, and low back pain healing remains unresolved. The typical phases of healing model is based on the concepts of time since injury, short-term equals acute, usually as an itis, and long-term equals chronic, usually as an osis, or apathies, which usually indicate mixed stages. This model is a misrepresentation of the complete healing process, since important clinical features that can assure an effective low back pain course of care have been overlooked while focusing only on time and pain. An updated phases of healing model called the 5POH demonstrates how the clinician can direct a more accurate course of care by understanding the presentation of the low back pain injury within the phases of healing model. Low back pain injuries are tissue damages attempting to repair, sometimes for the first time, sometimes repeatedly, and sometimes unsuccessfully. Low back pain injuries may be in various stages of repair, sometimes in several stages at a time, and involve different tissues. It is unwise to frame an entire low back pain diagnosis and course of care on information such as advanced imaging or plain film from an instance in time, since healing is a process. Therefore, it is impossible to determine which tissues were injured and which tissues have successfully healed using imaging. The 5 phases of healing, also known as 5POH model, proposes that the usual 3-phase symptom-based model becomes a 5-phase model that focuses on the patient's restoration to function, also known as RTF. The 5POH RTF model does not focus on the days in a phase of pain. Instead, it describes within each phase these 4 important components. Number 1, tissue healing indicators. Number 2, patient emotionality. Number 3, specific phase-sensitive care. And 4, markers for phase advancement. Part 3 is primarily the responsibility of the patient. Palliative care is not provided. It is instructed. This model requires monitoring, guidance, and accountability by the managing clinician. Let's look first at tissue healing indicators as they occur within the 5 phases of healing model 5POH. Tissue healing indicators describe function improvement, whether tissue healing appears to be advancing and permitting expected performance, or whether symptoms and compliance are limiting or delaying healing. Tissue healing indicators describe variations from expected function improvement, such as adaptation of new faulty motor patterns, also known as creep. Tissue healing indicators do not assess pain. Let's look at patient emotionality and how it fits into the 5 POH model. Patient emotionality indicators include such emotions as fear, worry, anxiety, frustration, guarding, antalgia, and optimism, for example. Patient emotionality, and especially with athletes, cannot be overlooked because it can be annoying for the athlete to not be able to train, not to be able to participate in their sport, and be sidelined. Let's look at number 3, specific phase-sensitive care. This includes monitoring and guiding tissues towards healing and function. This includes a patient accountable program utilizing a teaching and guidance platform to explain and demonstrate the individual steps and skills, including feedback reporting. Finally, number 4, as this fits in with the 5 POH model, markers for phase advancement. Markers for phase advancement describe the thresholds of tissue repair progress where further demands can be placed on the tissues while protecting prior healing accomplishments. Phase advancement essentially test drives the next level of tissue demands. Before a course of care can be prescribed, the clinician must be able to assess and determine the different phases of healing in the low back pain patient. The various tissue damages and faulty motor patterns must be assigned into their respective phases. The clinician should not simply point their pencil eraser at an MRI and proclaim herniation and stop there. Other tissue damages are expected in the entire patient presentation, including muscle spasm, muscle strain, postural strain, faulty motor patterns, inflammation, whether reactive or systemic, osteopathies, alignment, joint stability and function, prior and current scarring, immunity, and gut dysbiosis, for example, and in most cases, none of these can be seen on MRI. Damaged tissue does not function properly. How it does not function properly is as important as why. When there's tissue damage, movement patterns are modified around an injury, sometimes called Plan B or creep, in order to preserve pain-free function. However ineffective, this attempt is made nonetheless, subconsciously as in antalgias, postural adaptations, and immobilization, or consciously in order to restore some function, and especially in cases with athletes because of their determination to return to play. When Plan B is utilized without pain, it eventually becomes the new normal, also known as creep. When Plan B is utilized without pain, it eventually becomes the new normal. When pain arises using Plan B and no attempt is made to remodel or restore that injured tissue, another movement pattern is formed, Plan C, which may or may not provide pain-free function. Nevertheless, optimal function is lost. In essence, the tissue damage drives further faulty motor patterns that attempt to reduce painful movement. This can be observed when an athlete continues to train when the expected performance is hindered or develops alterations in performance in order to keep playing or play without pain. The original tissue damage is likely an undiagnosed faulty motor pattern. The tissue damage cycle is repeated every time there is a new movement pattern attempt around the original injury. When we pull back the curtain, we can observe insufficiencies in the treatment of low back pain. Low back pain can be understood as layers of faulty motor patterns in various stages of healing, not simply as chronic non-specific back injury or acute incidental back injury. Medically based clinicians can benefit from understanding the 5 POH and RTF model since it can explain their historical problems treating low back pain, since pain is not the only problem. Thank you for joining me today. Let's advocate for improved patient satisfaction and for the profession. Let's demonstrate a cross-culture willingness to strengthen medicine. Thank you.